Hello, everybody. My name's Ben, and today we're going to talk a little bit about healthcare. Now, healthcare is a huge topic that I'm sure everybody has heard at least a little bit about, especially pertaining to the privatization of healthcare, right? The American system is famous for this, with its high costs and general inaccessibility of care, as well as the ongoing struggle to secure Medicare for all the citizens of the United States. This is an incredibly important topic. But it's not always that you hear about the other side of the same coin, which is a public system that's in constant threat of being privatized. This is, I'm sure, a struggle that most people can relate to, right? A neoliberal government constantly threatens to cut funding and to privatize different aspects of our public health care. Canada is no exception to this, and especially Alberta. While our federal government recently made the incredible decision to expand Medicare to dentistry with the slow rollout of the Canadian Dental Care Plan, our provincial government has been busy not only rejecting this coverage that already benefits over 300,000 Albertans, but also steadily scheming to privatize one of the few things that distinguish us from our southern neighbors. Recently, they've been incredibly busy with a variety of things that mean nothing good for our public system. First of all, they transferred the land titles of a variety of our public buildings away from our provincial health service, essentially making it so that they dictate who controls and operates these buildings. Second, they split our provincial health service into 4 different branches, which, while according to the provincial government, was in an effort to make specialized care more easily navigatable for patients, according to some internal reports, it was done in an effort to essentially roll out a divide and conquer strategy whereby different sections of our public healthcare system can be more easily and steadily privatized than if they were to go after the whole of it all at once. Finally, and most recently, they legalized paying privately for medical procedures and the privatization of specific medical practices, effectively creating a 2-tiered system in which people who can afford to pay for care have shorter wait times and drain resources away from the public system. But why is this a bad thing, you might ask? Well, we have a perfect example in the real world of what happens when you take a public system and create a 2-tiered private-public hybrid, and that is, funny enough, Australia. So back in 1997, the Australian government introduced this hybrid public-private system, where essentially people who are willing and able to pay for services are able to do so and benefit from far reduced wait times compared to the public system. However, the public system still remains as a safety net for those who can't afford to pay. And we actually have a lot of data about what the results of that experiment were, right? So first of all, of course, private patients did benefit from lowered wait times, but that's at the expense of the public system, where patients not only experienced increased wait times, but their wait times actually almost doubled. As the human capital, doctors, nurses, other staff in the healthcare industry all experience drain from the public system into the private. But the consequences don't stop at wait times. The public system became reliant on a copay, where patients essentially are only covered 85% by the federal insurance plan and pay the remainder out of pocket. And this remainder that's paid out of pocket, well, occasionally is covered by a supplementary insurance plan, resulted in nearly 500,000 Australians actually foregoing care due to the costs of even just seeing a regular physician, which that's completely ridiculous. And that's completely ridiculous. To say that shorter wait times for a fraction of the population is worth nearly 500,000 people going without care, you have to be some sort of barbarian to believe that that is a fair trade-off, especially when compounded by the fact that the public system experienced increased wait times as a result of the lowered wait times for the few. But don't worry, the problems don't stop there. While hospital bed capacity increased fairly substantially, with private beds making up 1/3 of the capacity, these beds were not used for stuff like intensive care or emergency room care, as out of 630 private hospitals, only 36 offered emergency room services and none offered trauma services. This is, of course, because those services are not nearly as profitable as stuff like childbirth and regular surgeries. So while the wait time for quote unquote elective surgeries like knee and hip replacements became shorter for these people who were able to pay, it didn't necessarily contribute to lowered wait times in emergency care and in trauma care. These beds were not being used necessarily for public good, they were being used to produce profit for hospital owners. And this sort of ties into just the issue in general with including the profit motive in the medical industry. The inclusion of the profit motive not only dissuades taking difficult medical cases that would be unprofitable, but it also encourages treatment over cure. As in a case in the United States, where in a comparison between public and private kidney dialysis centers, private centers gave out less referrals for kidney transplants because that would take the patients off of dialysis and therefore stop making them money. But that's just the hospitals. We haven't even gotten into the insurance companies and that industry that popped up as a result of this privatization. So around 45% of Australians have a secondary insurance plan. These plans cover copay for all sorts of procedures and treatments, and even just stuff as simple as going to your regular physician. There's bronze, silver, and gold coverage, with the prices set to rise faster than the rate of inflation, and gold coverage being needed for the majority of surgeries. The insurance plans are by no means cheap either. On average, a family of four pays about $4,000 a year in premiums, and that's after the federal government's tax breaks that they give as incentive for buying a secondary insurance plan. So ironically, even the people going through the private system with private insurance end up being a burden on the federal government through government tax incentives, which effectively eat away at funds that could otherwise be used for bettering the public system and reducing wait times and actually improving the lives of all Australians instead of just the wealthy. So you might say, okay, well, if resources being drained from the public system into the private cause problems, then why not just privatize the whole thing? Well, have you heard of the United States of America? I think they've tried that already. The US healthcare system is a beast of its own. It's legendary in its scale and ineffectiveness, right? Not only is it the most expensive medical system per capita in public dollars, mind you. So their government is paying more money per capita than any other developed country in the world for private healthcare. But do these dollars buy better care? And the answer to that is no. Not only are they more expensive, but they have worse healthcare outcomes. They have higher unnecessary deaths that were treatable. They have lower healthcare coverage across the population, lower life expectancy, and not to mention the shuttering of rural hospitals, essentially cutting off large swaths of the population from life-saving care because it's not profitable. This kind of profit over people model is not only draconian, but just incredibly costly as private companies jack up prices for inelastic demand goods and services like medication and treatment, massively overinflating the cost of delivery of healthcare. But all of these things are facts that our politicians conveniently forget when discussing the privatization of our system. So please, I'm begging you, don't fall for the framing that privatization will save us. There is nothing supporting the fact that it will. It will only cut wait times for the wealthiest among us and essentially leave the rest of us out to dry. At best, at worst, if we were to go full privatization, not only would our costs spike, but our healthcare outcomes would decline. There is no argument to be made here. The public option is the only option. And I'm not saying that our current public option is perfect. It is by no means perfect. It needs massive improvements and massive expansions. And we can start by putting more money into funding facilities and staff. And that money can come from anywhere, but I would personally suggest taking the money that we give in corporate welfare, which in Alberta is approximately $2 billion a year, and putting that into something that'll actually benefit Albertans. And of course, money isn't everything, right? We still need competent management and reform of some kind to make everything more efficient. Our healthcare system is frankly just not with the times. There are so many technological innovations and patient management methods that we could use to streamline the process and decrease wait times at very limited cost to the taxpayer. We have an abundance of solutions, but none of them are privatization. And I hope that if you came into this video with a different understanding of how things worked, I've at least maybe opened your eyes to the possibility of an alternative. We don't hear about it nearly enough in our political system. And with a little political will and some creative thinking, we can massively improve the lives of all Albertans, not just the wealthy. If you made it to the end of the video, I really appreciate you. And if you enjoyed what you saw, please make sure to drop a like, comment, subscribe. Let me know what kind of content you'd like me to produce in the future. I appreciate all your feedback, and thanks again for watching. I hope you have a wonderful day.